Tonight, the CDC warning hospital admissions and deaths will likely increase in the coming weeks as the record-breaking COVID surge continues. We are already seeing signs here in Georgia. Right now, 24% of all patients staying in Georgia hospitals are COVID patients. That's up nearly 10% from last week. Children's Healthcare of Atlanta say it has 118 patients with COVID in its 3 hospitals. 74% of them have at least one pre-existing condition. 8 days ago, there were just 62 COVID patients. A week before, only 22.
And new at 11, COVID concerns are now causing ambulance delays in one metro county. Officials say people are calling 911 for non-emergencies, thinking that an ambulance ride will help them get their hands on a COVID test or skip the line in the ER. CBS 46's Sierra Cummings talked to the Henry County Fire Chief about this issue, and she's live explaining the ripple effect it's causing. What did you learn, Sierra?
Truly a ripple effect here. Not only are COVID patients filling hospital beds, but ambulances are already being diverted from one hospital to another because of the capacity issues. So officials say these non-emergency 911 calls, it's only adding to the struggles.
Just because you go to the hospital by ambulance doesn't mean that you're going to be seen in the ER any faster.
No faster and no COVID tests, yet those are two assumptions plaguing Henry County EMS.
There's a little bit of a misconception as well that if you were taken by ambulance to the actual hospital, that they would give you a test and then send you back on your way home. So you wouldn't have to wait in the lines, to get the test or wait at the urgent cares to get the test.
With a spike in Omicron cases and demand in testing came a surge in neighbors dialing 911 for non-emergencies. But Fire Chief Jonathan Burnett is not phoning in this plea, urging fewer transport requests, not only because they cannot turn people away. You still have to transport them regardless.
Yes, ma'am.
But also because of the delay for actual emergencies.
From the time that we're able to give the patient over to the care of the actual ER facility, sometimes that can be an extended period of time. And if that time frame extends, then that means our ambulances are stuck at the hospital. And if they're stuck at the hospital, then they're not being able to respond to the community.
While the state faces 4,000 COVID hospitalizations, more than 80% ER, ICU capacity, and a staff shortage, officials say non-emergencies should not add to the strain. And here at Piedmont Henry, the surge in COVID cases means no visitors are allowed at this hospital. You may remember this is one of 6 healthcare systems that issued a plea just last week saying people were showing up and adding to the delays in ERs because they were simply seeking a COVID test, which they can't do for you here at these emergency rooms. Now, the chief adds they don't want to discourage people from calling 911 if you truly feel you have an emergency. Live in Stockbridge, I'm Sierra Cummings, CBS 46 News.